Thank you, Louis. I have to work on getting my heart rate down after that, that talk. These are my disclosures. There's quite a bit of human planning variability when it comes to fenestrated endovascular. So this is a slide that I made several years ago, but if you look at this particular case, this was a perfectly planned case. And so I went back and I mapped it out with the clock positions on the top, and then you have the length of the fenestration from the fabric edge on the x-axis there. That's with 600 cases of experience. So I asked my fellow in red to size this case. Mind you, I taught my fellow how to size these cases, and this was his plan. So when we line up the SMA, he loses the left renal artery. Now then I asked my chief resident to size it, and she sized it here. When we line up the SMA, she loses the right renal. Now how can that be? How can it be two people that I trained to size these cases could be so wrong? Well, that's the problem. So here's a patient that presents with a juxtarenal aneurysm, nice juicy visceral vessels, some aortic angulation, and I'm going to walk through some sizing measurements here. You can see that there's some angulation. And when you do the geometric center line, that's how you calculate your angles. This is the geometric center line that Terra Recon spits out. It's very simple. If the graft is planned perfectly, the case will transpire perfectly. They always go well when they're planned perfectly. These are some pearls, the geometric center line. I use this to calculate the branch angles, but the manual center line must be adjusted to calculate the lengths. I'll show you what I mean by that. I come down through the axial CTs, I measure the widest diameter of the visceral vessel, and then I calculate the angle through that vessel. Same thing for the right renal, same thing for the left renal. And then when we manually adjust the center line, if you use the geometric center line and you straighten out the image, Terra Recon in this particular case is going to put both of those renal arteries at exactly the same distance from the fabric edge, but they're not. This is probably one of the most important slides I'll show you. And if you look at this particular patient, this was one of our PMEG patients, we calculated the distance from the fabric edge to the top of that left renal artery in panel A to be 34 millimeters. We created the graft in panel B, but you can see in panel C that that fenestration is about 6 or 7 millimeters too low. It doesn't line up with the left renal artery. We were able to easily cannulate that, but look at the center line on panel A and compare it to panel C in the Lunderquist wire. When we adjust manually the center line in panel D, we get that distance back up to that left renal fenestration. So that's what I'm talking about here. This is the curved planar reformats, which would, using the geometric center line, is going to place those renal arteries at exactly the same place. Not so. You can see that there's 2 centimeters of difference between these two. This is the graph that we created, and if you go and look at where that graft eventually wound up, it was a perfectly planned case with 12 minutes of fluoro time. For the sake of time, I'm not going to show this video all the way through. This is the concept of simplified FEVAR and using software-generated 3D printed templates to actually create a physician-modified endograft and to remove that human planning variability. This is a unique feature of the Treo endograft. What I'm demonstrating on the left there is 2 points of fixation in the distal graft. All I'm doing is twisting the delivery system, and you can see that the advantage that that gives you is it allows the graft to collapse. Now look at what happens in situ. This is a 3-vessel fenestrated case where we were having difficulty cannulating the right renal artery, so we collapsed the graft. The left renal is cannulated, you can see that. And as we collapse this graft down, we're moving that fenestration away from the target vessel so that we can then get a wire out through the fenestration and into the target vessel. And you'll see that this happens very quickly. So the wire goes, you gotta speed this up. So it goes out through the fenestration here and then into the target vessel. And more importantly, after we place that sheath into position, you can see us unwind the graft back into position. This is a very strong feature of this graft. So, TreoFit. We now have software-driven 3D printed templates. We use standardized materials to include 5/0 Tevdek suture, which is what they use on the graft. We use fenestration rings that are reinforced, and you can see those 3 physician-modified endografts in the bottom right panel there. I'm going to speed this video up for the sake of time, but you can see here, after we have created our 3-vessel modified graft, I believe this was done back in 2022, if I'm correct. We go ahead and reload this graft using specific tools. During the lunch symposium tomorrow, I'm going to show you some of the reloading tools that we have now that can standardize this technique. This is what the 3D printed templates look like. This was a case from back in 2016, almost 10 years ago. Think about that. Where we use this 3D printed template that has been sterilized. We can advance this over the graft. We can rotate the graft around, find the sweet spot for the fenestrations, create the endograft in about 35 minutes, and then treat the patient. And yes, we have done ruptures with this, Sharif. So I'm happy to say that we have the TreoFit Consortium. This was a meeting of 6 different sites from around the United States. We met at the VEITH meeting in 2023 and then again at the Stent Summit in 2024. My IDE has been democratized to these 6 sites. They're all approved by the FDA and currently enrolling. And in conclusion, physician-modified endografts are here to stay. Everybody is getting involved in this. Aortic anatomy is dynamic after branched and fenestrated repair, and it emphasizes the critical importance of precise planning, but also long-term follow-up. TreoFit is coming to a hospital near you soon. Thank you very much.